How can someone safely identify at home if they either have mast cell activation or histamine intolerance? Like, so they've gone through every doctor, they don't know, they have similar symptoms that you've described. Before going to see you, for example, and says, okay, I think I have this, is there any way for a random person like myself with no medical degree to be like, I think it's this, and maybe have little experiences apart from going on a low histamine diet for like a few weeks and see if your symptoms are better. But if they're not, then you're like, okay, well, I know it's not a histamine issue. And then, so it's just what, reducing their daily toxic load?
Yeah, I think so. The question is like, okay, so how do you get to a diagnosis? And do you have unexplained symptoms in multiple body parts that can't otherwise be explained by anything? Um, do really fragrant things bother you? Are you really sensitive to medications? Do random things that otherwise shouldn't bother your system really kind of throw you through a loop? Like when it gets too hot out or it rains out or you travel and or you go on an airplane, you go in a hotel and all of a sudden you get flushing and fatigue and brain fog and everybody else seems to be doing quite okay. Those are really key parts of the history that make me think mast cell is at play.
Okay.
Um, to your point, if you are concerned that you have histamine intolerance, then taking a DIO is kind of a nice proof of concept.
Okay.
If you are worried that you have mast cell activation syndrome, I'm going to say this out loud, and I've gone back and forth as to whether this is responsible or not, but I think it is try a medication to see if it makes you feel better. And so what you can do is you can try histamine blockers to start.
So like Zyrtec and all that stuff?
Yeah, and I try one at a time and see if it makes you feel better. But when I see people in clinic and I start them on histamine blockers, which we do for the right person, I always say there's a huge range of outcomes that can happen after this. I have people in my inbox that say, I'm thinking clearly for the first time in years. And I have people that say, are you sure you know what you're doing? Because I feel worse.
Mm.
And so, because people can have idiosyncratic reactions to the Pepsid, like their mast cells don't like it. And it's usually not the Pepsid, or the Zyrtec, it's the chemicals in there, like the additives. Because if you buy famotidine and you look it up on a website called Daily Med, there's famotidine, but there's also about 8 other things in there that help keep its shelf
Yeah.
stable. So I encourage people to kind of try some things on their own because these interventions are quite frankly really, really safe. And I would do it one at a time. I start with like Pepsid 40 milligrams twice a day, which is pretty big dose, but quite frankly, doesn't really have any side effects. Doesn't alter the gastric pH or the ability to absorb nutrients over time. That's always a question that I get. And do that for 2 weeks. And I track your symptoms very diligently. Everything from the brain fog to the fatigue to the tachycardia to the flushing to the itching. And then if that doesn't work, then try an H1 blocker. And sometimes you have to layer those two. But H2 blockers and H1 blockers are kind of can be really helpful. Here's the rub is that when you treat mast cells, so here's the mast cells. You can either use medications to stabilize the mast cells, which we haven't talked about.
Yeah, we will.
Yeah, we can work on the environment or the milieu that's causing the mast cells to be angry, whether that's mold or stress or food or I don't know, a friend that bugs you too much, and you can focus on that, or you can block the chemical mediators that mast cells secrete. So histamine blockers just block the histamine that's being secreted. So if you don't feel better on that, I, if you feel better on it, great. But if you don't, I wouldn't say that's a negative proof of concept that you don't have mast cell. It just means histamine's not your problem. And it could be from the other 1,200 plus chemicals that mast cells secrete. And then you talk about maybe using medications to stabilize the mast cells themselves.